In general, pulmonary hypertension is a rare disease, particularly in its form of idiopathic pulmonary hypertension, so pulmonary hypertension without clearly identified cause. There are other disorders that are in a way similar to PAH, to the idiopathic PAH, and these are diseases in which pulmonary hypertension it's associated with scleroderma, with lupus, Sjögren's syndrome, all sort of rheumatologic condition. When it's associated with HIV infection, associated with liver disease, congenital heart disease, drug-induced pulmonary hypertension. So these are all forms that are under the umbrella of what we call Group 1 PAH, and this is the group for which we actually have medications readily available, and we have a very intense clinical trial activity in this field. Then we have other types of pulmonary hypertension which are more common. Okay, great. So how common PAH is in the community? It's estimated to be about 16 people to 50 people at a million of population. So that depends on where you want to look at and what you want to read and what form exactly you want to talk about. But that's a rare disease. It's less than 50 people by all criteria in a million of general population. Other types of pulmonary hypertension are actually more common, and these are Group 2, which is pulmonary hypertension due to left heart disease. So anything that goes wrong in the left side, systolic dysfunction, heart failure with preserved ejection fraction, valvular disorders, all those things may be associated with pulmonary hypertension. And also Group 3, which is pulmonary hypertension due to left heart, to lung disease and hypoxemia, low oxygenation. You also have Group 4, chronic thromboembolic pulmonary hypertension, which is again a fairly rare disease, supposedly less than 4% or so of patients that had an acute pulmonary embolism, an acute clot, may develop chronic thromboembolic pulmonary hypertension. And also you have Group 5, which is a mixed mechanism, mixed disease status of pulmonary hypertension. Examples here will be sickle cell sarcoidosis or end-stage renal disease, for example.